what's been surprising in this pandemic was that there's so much secrecy. And I think if we don't address the secrecy and transparency, it's actually worse than the HIV/AIDS crisis. And I think Lena's right. The only positive thing has been the solidarity, but the solidarity of the most vulnerable and the most weak. I mean, even in my own country, both government and the private sector, have left many people to deal with the socioeconomic impact of COVID and the multiple lockdowns to their own. And so solidarity is there, but it's been very one-sided. And I think we see that in the way in which this vaccine nationalism has emerged. And it's a very pernicious form of vaccine nationalism because it's being exercised by the countries who come and lecture us about democracy and transparency and anti-corruption and accountability, but they're doing the total opposite. Pharmaceutical industry to do the total opposite. And I think that for me is a concern. So I'm less positive than Lena. I'm concerned that in the next pandemic and the next pandemic after that and the next big public health crisis, there's so much power has been handed over to the private market and to the private sector that it's now going to take us even longer to try and claw that back. And that's what we need to focus on. We need the groups, the legal organization, the public health organizations, researchers, scientists. We need donors to fund us to be able to do that work, to claw back what we've lost in the last year. And we didn't just lose lives. I think we also lost a lot of key principles around how democracy actually should function, particularly in the global south.